This is Dr. Drew Hall with Upper Cervical Healthcare of Los Angeles and Carson. Today we have a special guest. Her name's Aimee, and she actually has been under chiropractic care since a little kid. Her brother is an upper cervical doctor, and we're going to have her tell her story how chiropractic and upper cervical has affected her life and why she continues with care over the long term. So.
Yeah, I first got introduced to chiropractic when I was about 9 years old. One of my mom's friends was going to Palmer Chiropractic, and this particular individual also motivated my brother to want to go to chiropractic school. So I started getting adjusted when I was about 9 years old. I didn't have any reoccurring health problems. It was more or less just maintenance of health. But for me, because I'm also a dancer, I've been a dancer since I was 3 years old. I've done ballet, tap, jazz, you name it, which has totally taken my spine in a lot of different directions, probably in directions it's not supposed to go. So for me, it's been really, really helpful just to keep my spine in alignment, to keep my maintenance of health, especially because I'm always moving in different directions with it. So for me, I have been getting adjusted since I was 9 years old. I continue to get adjusted. I moved to Los Angeles about 8 years ago and met Dr.
Fortunately
Hall.
or unfortunately?
Fortunately. I moved here for a job. My other gig is I'm a professor, so I do a lot of sitting also, so that's the other thing. I do kind of have both ways. I'm a lot of movement, but then at the same time I'm doing a lot of sitting and a lot of sedentary movement, right? Or just a lot of sedentary motion. And so for me, I met Dr. Hall about 8 years ago, and so definitely been getting adjusted. It has been amazing. I'm the kind of person who actually would rather go to a chiropractor for my maintenance of health. So whenever I feel like maybe my sinuses are not loving me or whatever, I come to Drew and he puts me right back on track. So upper cervical has saved me. It's the reason that I don't get sick. It's the reason that I don't have a lot of issues. It's the reason that I can continue to move. Being 43 and I continue to be a dancer, and I have had not that many injuries. So chiropractic is the reason that I function well. It's the reason that I'm healthy, and it's the reason that I continue to come back and get more adjustments because man, he keeps me in tune and on track.
Yes, thank you, Aimee. I talked about this on one of the other videos, reactive healthcare versus proactive healthcare. We grow up in a system of healthcare where we generally are taught, if you feel fine, you don't need to do anything. If you feel bad, go to your doctor and swallow medication, right? This is a perfect example of someone who understands that keeping the spine clear over the long term may not be the cure-all, and you're still going to die someday, but you're going to live at your best. So, Aimee, thanks for sharing your story.
Yeah, thank you.